Welcome to another edition of Tom Talks 2. I'm Dr. Thomas Soltis, Westmoreland County Community College. We are coming to you from the TV studio here at our Youngwood campus. To my right is Rayanna Patterson. She's librarian at Westmoreland County Community College. And our guest for today is on my left, Director of Public Health Preparedness from the Pennsylvania Department of Health, Andrew Pickett. Andrew is here today to talk to us about the impact of the 1918 influenza pandemic, which the Westmoreland County Commissioners have declared October 2018 to be 1918 Influenza Pandemic Remembrance Month. Andrew's going to give us a little background on what public health is, how public health can help us deal with potential outbreaks of diseases today. So Andrew, thank you for joining us. This is going to be very informal. It's meant to be fun. You're going to educate us on topics we don't know about. Start me off with what's the difference between public health and, do I call it private health? What is it? I mean, what is public health?
Well, first, Tom, thank you for allowing me to be here. I'm really excited to be part of your 1918 Pandemic Remembrance Project. So your first question, public health versus private health. So in our community, public health and healthcare emergency preparedness, we sort of look at public health is keeping people from getting sick, and then what the healthcare sector, hospitals, clinics, doctors' offices can do to treat people once they are sick. And our program at the State Department of Health, the Bureau of Public Health Preparedness, works in both of those communities, the public health and the healthcare preparedness activities.
So with the difference between public health and private health, is the goal of your office to enhance public health so we don't have as much demand on the private health? Is that sort of the goal?
Yeah, ultimately, the goal of public health and the healthcare system is to reduce morbidity and mortality among the population. Specifically what we're trying to do is to make sure both the public health infrastructure and the healthcare infrastructure are prepared to respond to those sort of out-of-the-box threats, the things you don't normally think about, the things like pandemics, bioterrorism events, the public health implications of natural disasters. This has been, we've had a number of hurricanes. We've got another hurricane expected to make landfall later this week. So making sure that public health, healthcare, no matter what the threat is, we're prepared and able to respond.
Okay, so almost ahead of time before the demand overflows into excessive need for private health also.
Yes.
Now, I remember your presentation whenever you've done. Over the past 100 years, what do you see as some of the greatest impacts that public health has had?
So I will say, the science of public health has come a huge way in the last 100 years. 100 years ago, as you described during your presentation, we didn't know what a virus was. And now we have, antiviral medication. We have, influenza vaccines that we can develop a lot more quickly. So there's a lot of science that goes into public health. There's a lot of technological advances. Most of us carry around a smartphone. Well, that smartphone has more computing power than the Apollo mission had for sending humans to the moon. So, the ability to have technology, and we have systems in place using technology that allow us to detect a new disease, a new influenza quicker. And that detection gives us more time to be able to respond and treat it. So I think that the technological advances, the scientific advances, and then just the concept of preparedness. Our preparedness program, public health preparedness, didn't really come around until 2001, after the 9/11 attacks and then the anthrax letters. That was sort of the wake-up call to the nation that our public health and healthcare infrastructure wasn't doing enough to be prepared for whatever the next threat might be. And so I think the technology, the science, and just that mindset that we need to do more to be prepared, that's really where we've come in the last 100 years.
Were there changes that you would consider public health improvements that maybe like me or a person who's not familiar with what public health is would be surprised that that's also considered public health? I could grasp you're monitoring influenza outbreaks. I could see that.
Is there other aspects that are called public health that would surprise me a little bit?
You know, I think public health, you know, especially at the local level, also goes into environmental health considerations. Public health goes into, you know, when we talk about hurricanes, when we talk about flooding, you know, we've had horrific flooding in Pennsylvania this year. And, you know, most people don't associate public health with a flooding response. And yet, there are implications of public health. There are things that public health is doing in terms of monitoring the population for disease outbreaks that might be coming from infected floodwaters, or providing, you know, immunizations to those who are working in what's now a contaminated environment. So I think public health has a deeper reach into certain areas than people think.
Yes, yeah, I never would have thought of that tie of a flooding and then the potential of a disease after flooding. So the scope of public health is much broader than just pushing an immunization or keeping track of how many people have a disease. So it's much broader.
Yes, absolutely. You know, public health is anything that we as government can do to, you know, keep people healthy.
Is there a limit? As I was thinking about asking you these questions, is there a limit of like a minimum number of cases that would spark an interest in public health? Because I'm guessing using technology, if someone shows up at a hospital with an odd disease, that's reported.
Yep, so what we have is, we have what's called a syndromic surveillance system. So the majority of hospitals in the state of Pennsylvania participate. When you go in, that nurse is going to say, okay, what are your symptoms today? And they're writing that down. And more importantly, they're logging that into an electronic record. Well, our system can look at those electronic records. Now, we're not going to get your name, your date of birth, anything like that, but we're going to say, okay, what were the symptoms that these individuals came in? And so if we see, you know, even in the summer, okay, well, I'm seeing a lot of influenza-like illness, a lot of fever, a lot of cough. You know, that might be something that triggers an inquiry, a response from the state. You know, there are some diseases that, you know, one case is enough to trigger that. If it's something, measles, you know, one case is we're going to take public health action. We're going to reach out and work with that healthcare facility. But, you know, now 20 cases of influenza in February is not usually something that is outside of the normal. That's part of influenza season.
Mm-hmm.
But 20 potential flu cases in, you know, August,
right.
You know, that's something we would take note of. That's actually how the 2009 H1N1 influenza started. We had an unusual spike in influenza cases in late summer, early fall, and that's what triggered the massive public health response, because it was new and different.
So as we saw in the 1918 pandemic, clearly there was no preparedness. Nobody knew what to do, nobody knew how to respond, even what a virus was. What are our activities now as we get ready to enter into, we're in flu season now, what does the public health department do to sort of get ready for this?
So, you know, flu season broadly, you know, we're working with our healthcare providers, the hospital healthcare side. So again, going back to that public health and healthcare, but we do work together, and working with the healthcare side to make sure that they're able to do the testing, to do the treatment that would come with a normal flu season. You know, last year was a particularly bad flu season, so we are, you know, hoping that the vaccine is a better match this year. You know, we're certainly encouraging as many people as possible to get their flu shot. You know, that is the #1 way of, you know, decreasing the cases of flu, decreasing the severity of the flu if you do get it. So, you know, there are things that we are doing just in advance of a regular flu season. And then, you know, there are things that we do to plan for the big one. The one that, you know,
you have these kinds of discussions, like what might happen or something like that?
Absolutely.
Okay.
We actually have a pandemic influenza plan for the Commonwealth of Pennsylvania.
Okay.
So, you know, working with our partners in public health, with our epidemiologists, with our laboratory folks, with our community health folks, developing plans for how are we informed, how do we track it, how do we, you know, do what needs to be done on the response end. And then working with the healthcare side, you know, how do we treat it? You know, we have actually federal stockpiles of antivirals. So that first wave of cases, if we can provide them with antivirals to stop it there and prevent the transmission further. We have, you know, the federal government has systems in place to really try and reduce the time it takes to develop a new vaccine strain if there is a novel strain of influenza, you know. So, you know, typically it's 6 to 8 months to get a new vaccine. Well, they want to try and bring that down to 12 weeks, 3 months. Right. So, you know, between the antiviral stockpiles we have, the treatment ability that we have, really trying to squash it as soon as possible.
Now, what would happen? Give us a proportional number. I talked about how many people were infected in Pennsylvania, how many people died. Proportionally, what would that happen today? What would that look like?
So, you know, we talk about the 1918 pandemic. You know, the numbers I have say 30 to 35% of the population would have been affected. So that'd be 3.8, 4.5 million people within Pennsylvania.
Having this disease
today.
Disease. Okay.
And with a 2.5% fatality rate, which is really high for flu, normally it's less than 1%, but with that fatality rate, you'd be looking at 350,000 people who would die.
Just in the state of Pennsylvania?
Just in the state of Pennsylvania.
So the same things that we saw, an increased demand for hospitals, an increased demand for all services, would be proportionally increased then?
And the troubles we would hit with that would be increased as well. I mean, talking about, so 3.6, 4.5 million people affected, you know, they say as a planning assumption, 10% of those people are going to need medical treatment, are going to need to come to a hospital. Well, that's 350,000 people, 400,000 people. Guess how many hospital beds we have in Pennsylvania?
I hope a similar number.
It's right around 40,000.
Wow.
So, you know, the demand on the healthcare infrastructure is going to be massive if this were to happen. If this were to happen and we weren't able to get ahead of it like we plan to be able, or we want to be able to do.
If we weren't, and that's why I think the importance of getting ahead of it, as you said, you would almost see the reemergence of using whatever you could, as they did in 1918, a social club, a YMCA, because clearly there wasn't a proportional number of hospital beds. What brought you to this? I mean, what got you into public health and public health preparedness? I mean, did you study this in college?
You
know,
know,
part of this is because we're going to use this for college students also. Did you major in this stuff in college?
Not initially, no. Actually, what brought me here was the fact that I hate math class. I actually started out in the meteorology program. That was, you know, I love the weather, and I was also in high school at the same time Twister came out.
Yeah.
So like everybody wanted to be a meteorologist. You know, I got into my undergrad program as a meteorologist, realized a little too late how much math was involved. But at the same time, I was taking a couple geographic information science or GIS courses. And, you know, I was like, okay, I'm not gonna be able to cut it in meteorology, but this GIS thing is pretty cool. So I ended up getting my bachelor's in geographic information science. But at the same time, I was part of the meteorology club. And we had our county emergency management official come and give a presentation. And as I was sitting there on like a Tuesday evening, I went, you know what? That's cool.
Okay.
I want to do that. So I ended up getting an internship with the local emergency management folks, getting a part-time job there. And then after I graduated, was lucky enough to find an opening for a public health emergency management planner in the city of Detroit.
Well, almost tailored just for you.
And, you know, and I really didn't know much about public health, but, you know, I understood the concepts of emergency management and planning and training and being ready for threats that might be coming. And so I applied and got the job and really fell in love with that intersection of emergency management and public health. And so I worked in the city of Detroit for about 7 years and then found this position here. And so I've been working for the Commonwealth for
something that out there now that scares you? Or is there something that keeps you awake at night?
You know, I think those are two different questions.
Okay.
And I think what worries me is the stuff that's out there, but it's on the periphery. So, you know, we hear things currently in the Democratic Republic of Congo, another surge or uptick in Ebola cases. You know, we know that the likelihood of those cases coming into the United States is fairly small, but that's actually in a war-torn, ravaged part of Central Africa. It's very difficult for public health and healthcare workers to get in and do that public health work of trying to prevent the spread of disease. And so, you know, I think there's concern that this isn't going to be an even bigger outbreak there than was in Western Africa a few years ago. You know, and there's always new diseases or diseases emerging in different ways. And I think that's what keeps me up at night.
Now,
you know, something out there that we haven't heard of before.
Now, when you talk about locations, does your background in the geographic information part, does that help you too? In sort of, first off, knowing where all the different areas are at, and
you know, absolutely.
Okay.
You know, data is important in public health. Data, you know, we have epidemiologists, and all they really deal with is public health data. But everything happens somewhere, and if you can track where it's happening and when it's happening, and that's where that GIS sort of plays into it, that you can say, oh, well, we've got this cluster here, now how might it spread? Or it is spreading this way, so how can we deal with it?
okay. So answer the other part of the question. Said I asked you two questions. What was the other one?
What keeps me up at night is the stuff that we don't know about. You know, 3 years ago, have either of you heard of Zika?
No.
No one had.
Right.
Even those working in public health, we had no idea what it was. It was not on our radar.
Mm-hmm.
And then all of a sudden, in the course of 6 months, it's all over the place. It's affecting women and children and babies in the Caribbean and South America. And public health is going, oh my gosh, what is this?
Mm-hmm.
And it's that sort of, what is that next, oh my gosh, what is this? And is it gonna happen here?
Okay.
You know, ultimately we want to protect everyone everywhere, but if it were to happen here, how quickly could we get ahead of it? I don't know.
So both things are part of your job then, in preparing for the things that we know and sort of an unknown also. Are they similar? Would you be able to transfer some of what we do for influenza preparedness to a novel disease? Is there an overlap?
Absolutely. You know, the scientific practices of public health, the way our department operates, the way we interface with other entities, county level officials, local officials, that's going to hold true no matter what the disease is. And some of the practices in terms of, you know, what we call non-pharmaceutical interventions, isolation, quarantine, social distancing, closing down the schools, closing down the social, you know, the malls, those places. You know, if it's a communicable disease, those practices will help, whether it's a pandemic influenza, whether it's a regular influenza that's just really bad, or whether that's a novel virus. You know, in the last few years, we've developed a statewide Ebola response plan. Well, now we're saying, okay, you know, we've developed the system for highly infectious diseases, high consequence pathogens. So now we're looking at what other highly infectious diseases, high consequence pathogens, can we apply the majority of that plan to? If it was a case of smallpox, for example, you know, a lot of the same, you know, protective measures that we take for the one will apply to the other.
Do we see any resurgence of diseases that seem to have gone away? I mean, I know when we were talking before, I mentioned things like diphtheria or scarlet fever, diseases that I remember hearing about as a child, but I haven't heard of them lately. Are we seeing any of that?
So I'm not a clinician and I'm not an epidemiologist, but I know in the last 5 years, pertussis or whooping cough, you know, is a vaccine preventable disease. But as immunization rates that's sort of the fallacy of we've almost done too good. We've protected ourselves from this disease, so nobody thinks about it anymore. No one thinks, oh, I never hear about that. Why would I need to get immunized for that? And I won't, debate the immunization piece, but they are important because now that the vaccine rates have gone down, the disease cases have gone back up. Measles and mumps. There have been numerous documented cases of both in the last several years. And again, sort of I think going into the change in culture around immunization, these are things that, I won't say were eradicated, but were much lessened in 20 years ago.
Yeah, right. And I hardly remember seeing any of those cases. Now I read something just passing that there's an outbreak of typhus in the Los Angeles area, and that's which is they're saying is borne by a mosquito.
Mm-hmm. And I've seen a couple of newspaper articles just in the last couple of days about it. But that just goes to show that it can happen anywhere, anytime, any place, and emphasizes the need for preparedness.
Yeah, typhus doesn't normally show up. I mean, we haven't heard of it in a long time. It's normally most well known for traveling with armies in the battlefield or whatever, and to see it in a city. So I imagine anything like that gets your attention constantly. Now, also we know that you've been given another task by the Department of Public Health. Tell us about the other part of your job now.
So, in addition to our preparedness response activities, on January 10th, 2018, Governor Wolf signed a disaster declaration for the opioid crisis. Normally, disaster declarations come out when there is a flood, a hurricane, some major natural disaster.
I don't mean to interrupt you, but can there also be a declaration for an epidemic disease?
So right now, Pennsylvania law does not allow declaring a public health emergency. There's actually a bill in the legislature currently that would allow for declaring a public health emergency as opposed to a disaster emergency.
Okay.
The public health emergency really being restricted to public health interventions as opposed to the whole of state government. But since January 10th, the Commonwealth has created an opioid command center where we've brought together representation from, I think we're up to 15 different state agencies and the governor's office and other elected officials who are coming together to sort of talk about and strategize the response to the current opioid crisis, which is certainly a public health emergency that we are dealing with aspect of it as well.
So when you were an intern, starting at first, did you ever picture that you would be involved in policies dealing with opioid addictions or as even a role of public health?
No, I mean this was not something that 21-year-old college Andy really thought about. But over the last decade plus that I've been in this career path, it really has come to the forefront.
How similar is that to, and I'm going to bring you back now to communicable diseases, how similar is that approach to something you would do with influenza? And are you taking the same strategies that we would have had with a communicable disease and look at the opioid epidemic? Or how is it similar, how is it different?
So, similarities, we're going to continue to, on a communicable disease, we're also pulling in a lot of data. We're taking that data, we're analyzing that data, trying to know how to get ahead of the problem. We post, during regular influenza season, we post, the number of cases and the case counts and a graph of what our trend line looks like compared to the previous flu seasons, so that we in the public and healthcare and academic are all aware of what's going on. I don't know necessarily, the partners in the room might be a little bit different. We're working very closely with the social service agencies, the Department of Human Services, Department of Drug and Alcohol Programs, Department of Aging, as well as the law enforcement side, Pennsylvania State Police, Commission on Crime and Delinquency, who have roles and responsibilities within this opioid response. We might be working with a slightly different set of partners in terms of a communicable disease outbreak, a new pandemic, but that partnership, no matter who it's with, that's really important to get the job done.
So do your friends call you like the disease guy, the drug guy, things like when you show up for like a meeting, a night out with your friends, do they like tell us stories about diseases, or is
you
it
know,
like,
honestly, I think we kind of avoid it because it might get too depressing. You know?
So sort of like talking about the pandemic.
Right, exactly.
Yeah.
But you know,
do people what do people ask you about? I mean, like when they just run into you and they know what you do, what kind of questions do you get?
you know, I think I get a lot of the, well, have you heard about this disease outbreak? You know, what are you doing about this disease outbreak? Or should I be concerned about this?
Mm-hmm.
You know, should I be concerned about this upsurge of Ebola in the Democratic Republic of Congo? You know, no, probably not. There's not a whole lot of international travel from there to here that would import a case. But, you know, should we be concerned about typhus in Los Angeles? Maybe a little bit more. Should we be concerned about novel strains of avian or swine influenza in China? Maybe, because there is a lot of that global interconnectedness that does make our job a little bit more difficult.
So you mentioned something earlier that I kind of want to go back to. When you were talking about resurgence of things we hadn't seen before, is there a danger of being done in by our success? Like we get so good at something, we're so good at decreasing traffic fatalities. Is there going to become a point where people begin to say, I don't need to do anymore, that's not a problem? Is there a danger of being done in by our success?
I think there's a level of complacency.
Okay.
You know, when we get to a point where, you know, oh, I don't need to worry about that anymore, so then we don't worry about it. And that's when our guard is down, our back is turned, you know, and we're gonna get caught with our proverbial pants down.
Okay.
And I think, you know, making sure that we avoid that level of complacency, whether it's with vaccine preventable disease or injury prevention efforts, that, you know, we need to avoid that complacency because, you know, whether or not that issue comes down, that lack of preparedness, that lack of that cautionary mindset just opens the door to other threats.
Is there a way to like use the technology that we have, since as you said almost everyone has a cell phone or something like that, is there any mechanism by which to use that to warn people? Because I know here through the college we have, if we have to close because of snow, we could get the word out to everyone who signed up through. Is there something like that being discussed on the state level?
So, both at the state and federal level. Actually, if you received your wireless emergency alert,
I did not, no.
you might want to talk to your cell phone provider. But you know, the federal government has ways for nationwide alerting of the public through broadcast media and now through our cell phones. So we all got that alert. That's a way that federal government, FEMA, emergency preparedness officials can broadcast information to the public. The National Weather Service does the same thing. You know, if there's a flood warning in your area, you'll get that same kind of alert on your phone if you don't turn it off. I recommend you don't turn it off. But at the state level, we also have a subscription system similar to what you have on campus, where you can subscribe to state level alerts. The link to that is on the state's General Emergency Preparedness website, which is ready.pa.gov.
Okay.
So you can do that. It's called Code Red, is the system that we have. And so you can subscribe to any number of different kinds of alerts through that, you know, whether it's a weather alert, you know, all the state employees get, you know, if there's office closings due to winter weather through the system, if there are Department of Health alerts, you can subscribe to that through the system.
So that is, and it's ready.pa.gov.
Yep.
Okay, so anyone can sign in, give their information, get updates and things like that. Before I let you go, because I know you have to make it back to Harrisburg and things like that, and I've beaten you up with epidemics and opioids and things like that. Just for a little bit of fun, tell us something about you that would surprise us. A hobby, an interest, something you do to kind of make it a little bit light as we're getting ready to head on out.
So I actually play euphonium in a local concert band.
What is euphonium?
A small tuba.
Is it really? And where did you pick this up?
I've been playing in bands since elementary school. Band started in 4th grade, and
Really?
I picked up a trumpet in 4th grade, and I haven't been able to get away from music since.
Wow, that's fantastic. That's the kind of stuff I like to hear. So, Andrew, I do want to thank you for hanging out with us. You have really given us a lot to think about. I always enjoy our conversations. Would you consider coming back for us?
Absolutely, anytime.
Thank you. I do appreciate it. Rayanna, as always, thanks for bringing my partner all the way through this. As we're about to wrap this up, I'm going to end it the way I end every session, every presentation that I ever do. I could end this with a proverb. I could end it with a prayer. I could end it with a wish. I could end it with a whole bunch of different ways. I won't do that. I'm going to end it the way I end everything that I host, with my homage to the greatest game show host of all time, Bob Barker, who ended every Price is Right by saying, help control the pet population, have your pet spayed or neutered. Thank you for joining us. I'll see you next time on Tom Talks 2.